سليبرتي.
دكتور أنا باخذ منك تاريخ الطب اليوم.
أهلا دكتور.
الله يحييك. اسمك الكريم؟
اسمي فواز.
العمر؟
عمري 54.
وش تشتغل فواز؟
أنا مهندس.
مهندس ما شاء الله. متزوج؟
إيه متزوج.
عندك عيال؟
لا ما عندي.
ما شاء الله. جاي لحالك اليوم؟
إيه جاي بالحالي.
ما شاء الله. سلمى ايش اللي جابك اليوم؟
اللي جابني يطول عمرك السلامة إني عندي قلق من النظافة وزي كذا وإني أغسل يديني بكثرة. يعني آخر فترة تطور فيني وضع إني أخلص علبة الصابون بسرعة، وبرضو يديني ناشفة مع كثرة المعقمات وزي كذا. برضو القلق يصحيني من النوم، إني أتأكد الأبواب والدراج مقفلة وزي كذا. برضو بشكل عام نظافة البيت وزي كذا إنها تزعجني إذا ما كان نظيف ولا كان مرتب البيت.
وش يزعجك؟
إذا ما كان مرتب أو ما كان نظيف.
وش تسوي؟
أرتب أنا بعض الأحيان في نفسي، يضيع علي وقت كثير. ياخذ مني وقت كثير إني أرتب الأشياء بكثرة.
كيف يعني؟
يعني إذا حصلت دولاب ملابسي ما هو مرتب، أطلع كل الملابس وأرتبها من جديد.
طلع كله ودخل من جديد.
يا سلام.
طيب متى بدأت معك هذه المشكلة؟
هي من زمان معي، بس آخر فترة تقريبا آخر سنة زادت بزيادة.
من آخر سنة زادت.
إيه.
تذكر متى بدأت؟ أو في شيء خلاها تبدأ؟
ممكن من 9 سنوات كذا شيء، بس ما كانت للدرجة هذه.
وش اللي خلاها تبدأ يعني من 8 سنوات وش كان؟
ضغوط الحياة زي كذا.
يعني ما في شيء محدد خلاك؟
لا ما في شيء محدد.
بس من سنة زادت؟
إيه من سنة زادت كذا.
طيب قلت لي إنها تأثر على نومك صح؟
صحيح من النوم بعض الأحيان أتأكد إذا الباب والدراج مقفلة وزي كذا عشان لا يدخل أحد البيت.
وأنت خاف من إنك ناسية
إيه.
كم مرة تصحى من النوم؟
مرة ولا مرتين بعض الأحيان.
وهذا متكرر كل يوم؟
ما هو كل يوم، بس ممكن مرتين بالأسبوع 3 مرات.
تصحى من النوم؟
إيه.
هي زادت من السنة هذه، زادت الأعراض؟
إيه زادت.
طيب أنت مهندس، هل أثرت على وظيفتك؟
إيه أثرت على وظيفتي، إني أراجع الشغل أكثر من مرة فتتراكم عندي المهام وزي كذا.
تراكم المهام؟
إيه.
طيب هل أثرت على علاقتك بزوجتك؟
أثرت إني سببت قلق في البيت، أزعجتهم زوجتهم على كثر ما إني أعصب ويزعجني الأشياء.
طيب هل تجيك أفكار إنه لازم أقوم اليوم مثلا أخلص شغلي الصباح قبل ما أروح، ولا يعني طول باليوم؟
طبعا المشكلة إن يعني أي شغلة بسويها تأخذ معي وقت طويل.
قلت لي هذا، بس أنا يعني تخلي الشغل مثلا تروح لدوامك، تخلي شغلك الأساسي وتقوم مثلا تقول لا لازم أرتب هذا بطريقة معينة قبل ما أروح الدوام.
إيه.
هذا يحصل كثير؟
إيه.
هل زرت دكتور قبل؟
لا ما زرت دكتور.
طيب كيف علاقتك مع أسرتك؟
ما هي سيئة.
طيب كيف طفولتك كانت؟
طفولتي أمي كانت شديدة من جهة الترتيب والنظافة وزي كذا.
كيف؟
آه،
تخليك ترتب
بالضبط، كانت إذا يعني حسنا شيء تخلينا نرتبه، إذا وصلنا شيء ننظمه.
كانت تضرب ولا يعني بس
كان في ضرب إذا ما في استجابة.
طيب كيف علاقاتك بالعمل؟
علاقاتي في العمل آخر فترة صارت ما هي كويسة، بسبب إنه تراكم عندي شغل وزي كذا
صار في ضغط
إيه.
يساعد عليك. طيب في كم سؤال ابي اسالك بيكون حساس شوي بس هذا بيساعدنا ان شاء الله. انت مدخن؟
إيه.
من كم سنه تدخن؟
من 7 سنوات تقريبا.
كم تقريبا
باكت في اليوم.
باكت باليوم. طيب هل تشرب الكحول او
لا.
شيء يحاول يساعدك بالاشياء هذه؟
جت فترة أدخن حشيش إنه
يهدي ايش؟
أهدي، ما عاد أتحرك كثرة وزي كذا.
والحديث هذا متى؟ قبل كم؟
جت فترة استخدمته بس يمكن من سنتين.
من سنتين وقفت؟
أو سنة ونص تقريبا. إيه.
من سنة ونص وقفت. يعني تقريبا قبل ما تبدا الاعراض الزيادة.
استخدمته فترة شهر بس.
طيب هل عندك امراض مزمنة؟
لا، ما عندي أمراض.
هل سويت أي عملية من قبل؟
لا، ما قد سويت يعني.
ولا عندك حساسية من أي شيء؟
ما عندي حساسية.
طيب بالأسبوعين اللي راحت كيف مودك؟ يعني
متوتر ومعصب.
دايم؟
إيه.
طيب والحركات المفرطة هذه اللي تقول عنها؟
حركة إني أقوم أرد.
هل بديت يعني هل عندك هوايات؟
إيه، رسم.
بالأسبوع اللي راحت كيف كان؟ هل ترسم عادي؟
ما رسمت لأنه ياخذ مني وقت في العادة.
مم.
ما كنت فاضي تقريبا.
هل تسمع أصوات غريبة؟
لا، ما أسمع.
أو تشوف أشياء
لا.
ولا تشوف شيء؟ طيب مع كثرة الضغط والدوام مع الأهل هل جتك أفكار بعض الأحيان تقول أبغى يعني أخلص من الدنيا هذه ولا شيء؟
لا.
قدر الله. الحمد لله. طيب
1 minute more.
طبعا أنا حاب أشكرك يعني ما شاء الله عليك هذه خطوة، هذه أول خطوة بالعلاج اللي جيت لحالك ما حد ضغط عليك إنك تجي ولا حد ضغط عليك تجي.
هو أنا خفت إني أدخل على عمل زي كذا عشان كذا بدأت جيت. طبعا مع مساعدة زوجتي.
تمام. وهذا بداية العلاج إن شاء الله إنك جيتك هذه بإذن الله. هل عندك أي أسئلة؟
لا، شكرا لك.
تمام بإذن الله بنشوف بعض التحاليل وبعض الأشياء ونشخص بإذن الله.
شكرا.
Thank you very much. Criticize Fawad and criticize Rayyan. Fawaz first. No criticism. Now you are expert. What is the diagnosis? OCD. خلاص بس أنا أريد هذا عشان I want to distort your whatever thoughts. Okay. Do you think that this patient has بلاش الجوال يا فواز. Do you think that Fawaz is OCD patient? You can just the first impression as if he is OCD. Yes. Yes.
Yes.
العظيم ثلاثة. Okay. You have something?
I want to say it could be OPCD.
Okay. OPDC.
OCPD.
OCPD. Do you know what's OCPD? Don't answer. Do you know what's OCPD? At all? No ideas? Any, please?
It's obsessive compulsive personality.
Obsessive compulsive person's disorder. Thank you very much. So you think that your colleague has OCD? I don't think so either. Do you know why? If he is OCPD, he will be more groomy. مشخص كده ومظبط ويعني وكل شيء بيقول لكن ما شكله كده. Okay. So he should be more groomy. Grooming means يعني كل شعر في مكانها. Okay. Each.
واصلة دكتور.
But there's one.
This is why.
There's one thing.
Okay. Are you? والله ولا تعزموا مع الشباب. Okay. Do you? Why he is not OCD?
He's not OCD.
حسن.
ريلاكس بزيادة.
كويس ايوه يعني جايبهم بس كده to show that أنا OCD وجايب البتاع. I agree. So he was not, you know, عادة if you have problems, you will suffer from this problem. I'm depressed. I came to you ما هو عشان because I want to solve my issue. I have problem. So that could be this sense. We will just see this sense with your colleague. Okay, Rayan. Any problem with Rayan? Now again, you are more expert. بكرة حتكونوا expert تماما إن شاء الله.
You look at the iPad more than you look to the patient.
Well, defend yourself.
I was taking
مو يعني مو بوكس يعني.
I was taking note, but I was making sure of my eye contact when.
I don't agree with you.
Me neither.
Because he was really trying to take notes, but he was with his patient. So I think yeah, thank you very much for participating. You know, you should not in general just show your patient only صلعة or whatever, but at least if you need to take notes you have to look at your iPad or whatever computer. So just you know, logically, objectively, I think he was okay. He was doing okay, but he was writing a little bit. Like I'll tell you, he is in the lower normal range.
Yes, it's the beginning.
يعني ممكن إنه but be in his shoes or don't spend more time in your iPad. Sometimes, by the way, signs of anxiety, sometimes you exaggerate doing something. Just you are trying to just fade away your anxiety with some behaviors. This is a secret of how to assess people, and it is normal. I will look at my iPad more and more. إذا كان كل الناس اللي جالسين consultant psychiatrist وأنا doing that, I will just just try to just hide my anxiety, which is okay. That's okay. Any other things? Okay, tell me about your patient. طبعا he utilized many facilitative techniques. I like his way. He was with his patient. Yes, I agree. Maybe he was, so concerned just to take notes, so he will just present now. But in general, it was really good. Thank you very much. Yes, thank you very much for coming. Yeah, please. Thank you, Hassan. This is very important. Usually acknowledging people, even for something, very minor things, is very important. If you want people to like you, please reinforce the good behaviors they did for you. Anything, acknowledge. Oh, thank you very much for just telling me this. Thank you very much for guiding me. Thank you. Acknowledging things is really لم يشكر الناس لم يشكر الله. Thank you very much. Tell me about your patient.
My patient is Fawaz. He's 54 years old.
لا 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 لا. أخوك الشايب سمعوا هذا. استخدم الله. لا تخاف. Okay.
My patient is Fawaz. He's 54 years old. He came today complaining of increased anxiety and
It's very important to concentrate on the chief complaint.
yes.
Okay? So why he came? The chief complaint, this is why he came. So if he just went at the end of the interview without solving them, chief complaints, that means you didn't do anything. So your job is to help him to solve the chief complaints. Okay?
Yeah. His chief complaint was that he's getting more stressed at work because of his symptoms, and which is that he has repetitive movement for specific.
Now you are talking psychiatry, repetitive, okay?
Yeah, repetitive things and compulsions that he needs to do, like he wakes up at night to close the doors again, which is already closed.
You know what we call this in the obsession?
Compulsions.
Compulsions, by the way,
Compulsions.
gene,
Compulsions.
compulsions. They can, we have more than one things in obsessions. Some people are raising their hands. Do you think what you call this? Going and,
Obsession. يعني
this is obsession, like in three types of obsessions.
إيه security something
Checking,
checking yeah.
just to checking. I will go and check. I close, the door of my car. No, yes, I will go and check. Checking.
Can we call it stereotype?
Say it again.
Can we call it a stereotype of obsession?
Oh, no. Stereotype, yes. Repetitive,
Behavior.
usually behavior. Movement. You can say stereotype. And the stereotyping, even it has a cognitive things that if you are stereotyping about Arabs, and most of the Arabs are terrorists, that you have cognitive stereotyping. So it is stereotyping not limited to behaviors and not just repeating things. Stereotype is just sort of ideas which is others people, all the social media are talking about something, so it's a stereotype. So you are affected like other people. So it is not only stereotyping, but specifically we can sometimes say that this is a stereotype behavior. Movement, usually movement rather than even any other behavior. Aggressive behavior, don't say aggressive behavior, stereotype behavior. Movement, yes, I have stereotyping in my movement, or just maybe just doing the stereotype, for example, just doing something like this, play with my mustache, or this is stereotype. Okay?
Starting 1 year ago, increased.
Thank you very much. Don't forget the start of the problems. Is it since childhood or it is recent? Thank you very much. Come.
And increased in severity right now because of
Thank you
his-
very much. So it's increased in its severity, not in just plateau. It is increasing. Okay.
affected his sleep, his work, and his family, his wife, his relationship between him and his wife.
Intimate relationship
Intimate relationship.
or sexual. Say it again.
Yeah.
Okay.
Uh,
لما تتزوج we'll say sexual, no problem. That affected his sleep, his sex, and his performance at work. You said, okay, what else? Thank you very much. That means there is a problem. Started well, gradually, or you said it what, progressively or
No,
intuitively?
yeah.
Okay.
That's about his all of his symptoms.
Okay.
Past history, his
Thank you very
childhood.
much. Stop. Amran, put your mobile there. Specifically.
He lost the bonus now, but doctor.
Okay.
ADHD.
ايوه دكتور خذوا واعطيه الباس اللي يستاهل.
Okay, I will tell you, please stop. By the end of the history of a present illness, you should reach the diagnosis. By the, just when you finish the history of present illness, that means خلاص انت عارف chief complaints and عارف when it started from. Most probably you reach the diagnosis. Now you will have more data to support your diagnosis, either in family history, for example, or previous history, or whatever. Then you will examine him. Yes, he has this, the behavioral stethoscope, as we call it. And yes, I assure that this patient has obsessive murmur, or whatever you call it. That's excellent. Okay, so past history, negative, family history.
Family history. His mother, from what he said, maybe she has also.
That's excellent. So this is another support. So he is going to tell me at the end, I have this patient and these are the proof. I already said the proof. This is the way you need to inspire others when you talk about anything. ما خلي الكلام عام. You are saying something كأنه معدود عليك. So you need to talk about what is, you need to mention the proof before. I reach the conclusion because what I have said before. تمام رائع. You're excellent. Okay.
That's it. No past
Okay.
medical.
I'm satisfied. Okay.
Yeah.
طبعا you need to at the end of the history of business, don't forget 5 S's.
The
Put
severe.
it in news. Okay. You mentioned already about the sex, the sleep,
The severe stress.
the severity,
Severity,
because you said it
yeah.
affected his job. That's okay, fair enough. We have 2 things. This is why. ما في 5 S's بالكتب in the books. Okay, but that, I think this is very important. We have 2 S's. The first S is
Suicide. صح. Yeah.
do you know
أمور.
what else? One day, this is the group, dynamics. A long time ago, maybe 4 years or so, I was asking one of your colleagues, maybe now graduated, I asked him something, and his peers, his colleagues, يعني تبرعوا ويساعدوا. I use that remind me of one example. عارفين رحمة الله عليه ماجد الشبل. ماجد الشبل كان مذيع في القناة الأولى وكان يسوي برنامج ايش اسمه؟
حروف. لا.
فكر تربح حاجة زي كده. فالمهم one day سأل سؤال للي عنده في الاستوديو. سأله ايش اسم وزيرة خارجية الهند؟ رئيسة وزراء الهند سوري. فطبعا ما أعرف. I was telling the story to my students, and I told him, do you know, I started by this, do you know Munira Ghamdi? I was astonished. I said, yes, this is my mom. Oh my goodness. issue is he asked, هذا ماجد الشبل, asked his whatever الكلاينت الموجود, مين هي رئيس وزراء الهند, he asked him his منيرة غاندي. طبعا هي انديرا غاندي, لكن وصلت من الحضور غاندي, he said منيرة غاندي. So I told them, do you know Munira Gandhi? He said, she is my mother, doctor. So I was in trouble instead of he. Anyhow, I just whispered to him before you just make any problem for me. Okay, tell me about the mental state of this patient.
By in the mental state examination, his appearance was normal dressed.
Regarding appearance, he was, please don't forget, I told you, please write what I, some noticed. Please write some phrases. That will help you too much. He is reasonably dressed.
Reasonably dressed, hygiene.
Do you think he is reasonably dressed?
طبعا.
Okay.
Good hygiene, not smelling.
Yeah, Amra. Okay.
Yeah, the effect of his mood was a little bit anxious. Not agitated, just anxious.
Do you think he was anxious?
By his history, he needs help.
Please.
Oh,
You are talking about what? Mental state here and now, not a state.
Yeah.
Okay. Thank you very much that you know that. It is just Okay.
His mood was normal mood, with a little bit mild anxiety.
Mild anxiety.
Because of his.
He was not anxious at all. Look at him. Look at him. He is relaxed. He didn't struggle at all. What kind of anxiety? This is why. رغم انه ما شايفينه حسن ما شايفه هو somebody, لكن he didn't show us. He didn't show that he was anxious. Yes, I agree with you. Some obsessed people. Please go ahead. I'm so sorry.
Regarding to the anxiety, he was all the time when he asked him question, he was like moving his leg, so there was a lot of body sign. Shall we consider that?
If he was like this, he was like this. He was not shaking his head. It was really.
I mean leg.
Even leg or whatever. I know. Well, I pick the people and whatever. This is my job. The problem. He was not. He was not even. This is the way that if I'm really anxious, yes, you're right, but he did not. But it is frankly, we need.
What
to be objective.
about the movement that like?
This is his way. This is his style. This is not. He didn't want to. He's not. It is. Well, I will tell you about one. I can write a book about him now. So this is his stereotyping. Well, each of us has some. So this is not part of the role play whatsoever. Because even later on, like, thank you very much. You noticed something. Like, make sure, Well, this is the sense I got, and I really later on I watched him. It is because of anxiety, or this is his way.
Because doctors appear only with some question, not all the time that will he sit in front.
Thank you very much. It is not. Take it from me. I cannot say more than that. Okay.
The stereotype, he was checking his
Yeah,
message.
until the end of the
لكيف أنت بس لا بس المود was قلنا بس
Go ahead عشان الوقت. Go ahead.
the behavior
المشكلة انك امام psychiatrist كمان.
in the behavior he has stereotype but no compulsion because of the mustache thing. Because I thought it was compulsion for the mustache, but you said it's
That
Yes.
would make him again, so he might have this thing. I can go ahead.
so behavior. No, from what I saw is normal.
وقت يتداركنا
Yeah,
جدا.
perception. Perception also.
Was there any abnormal perception?
No regional
Say,
perception.
there was no abnormal perception. No, you need to ask him. The objective thing is, do you hear voices that people they cannot hear?
Yes.
This is the question you need to know how to ask other people about hallucination. Some people, they, of course, you need to prepare your patient about asking about serious or sensitive issues. Okay? What else? So you finished 2 A's, 2 B's.
Communication. Tone of voice was normal.
Do you think that he was monotonous? Do you know what the meaning of monotonous?
One single
It
tone.
is-
Not have.
This is why it gave more than one, impression that he was not OCD. People who are anxious sometimes, it will appear in their voices and tone. Go ahead.
So.
About cognition, عشان
Yeah.
وقت.
Cognition. He has some thoughts is normal. He has some delusion about checking, rechecking.
Okay. Come.
Yes.
I know it's good. لأنك أنت اللي did something major things لكن أوكي همشي لك إياها إلى نهاية الكلام. كمل. Okay, what is the definition of delusion?
Delusion.
والله العظيم
صح.
delusion. تعرف من فمك أدينك. What the definition of delusion? See,
Delusions.
many bonus seeking people, this is bonus seeking people. Okay.
delusion شيء يحس بهوس يعني he thinks it's something.
ايش اسمه بالعربي؟
خير ما أعرف.
اسمها
دلالات.
He thinks something is true.
It's abnormal thought behavior, abnormal thought affect, abnormal thought cognition. I'm telling you, it's abnormal of which of this A, B, C. Delusion is abnormal of. Yes, abnormal of. Abnormal of cognition. Yes. Characterized by كمل definition.
It's fixed.
أعطيه المايك ولا بس المايك virtual يعني. Go ahead.
It's fixed false beliefs.
Fixed,
False beliefs.
false, unshakable
Uncheckable.
beliefs. That's good, which is against the background of the patient. This is the definition of delusion. You said he had delusion. حكمت عليه بالجنان والرجل. ممكن يسوي لك شيء طبعا. Okay. Why you said that? Yes. غير رأيك ولا؟ غيرت رأيي. تمام. الله سبحانه وتعالى أنقذك. Okay, that's good. Okay, so there was no delusion. No delusion. Okay, what he
No hallucinations.
خلصنا
إيه
البيت.
صح معلش. And he has obsession. That's
Okay, that's good.
yeah.
This is in the, we are talking about obsession during
Yeah.
cognitive state.
Yeah. Obsession.
You remember the pyramids, which
Yes.
is, poverty of thoughts and overvalued ideas, then delusion, and obsession. That's good. Why he had obsession?
Because he's thinking a lot of.
He has repetitive thoughts about cleanliness and checking. That's good. Okay. عشان الوقت. Okay, what else?
Yeah. He seems like oriented to time, but need to be tested. And the shit.
say, be very frank.
Vividness.
People, they love people who are really frank. And most of the people, they don't like sneaking behaviors. Most of us. But this is, I'm so sorry, I'm not saying sneaking behaviors, but they try to be frank in general in your life. So if you don't know something, hide it. Or hide it, don't say it. Okay. Right, what is your diagnosis?
Diagnosis based on the history and OCD.
You need to mention something very important before قبل ما أنساها, which is what during the mental state. سوي لك زي فكر تربح. He should mention something very obvious.
The
Wait, just raise your hand.
What's the question?
مين اللي ما أخذ bonus?
What's the question?
I will repeat the question. He missed something very obvious and important during the interview. He should report it. In Mahad bonus, raise your hands.
Sanitizer.
إيش؟
Sanitizer.
Thank you very much. He is really, you should say that he is always, having this and he needs to clean. And this is very important. You know why? Your supervisor, I'm at home. And this patient, just came to you in the emergency. Your job is to tell me as if I'm seeing this patient. Okay? So if you tell me that even he had this, okay, that's good. I will be, happy and relaxed that yes, this patient is OCD. What is the investigation you'll do, and then how will treat this?
In the bio, there is specifically for the OCD, I would do brain imaging.
You mean the investigation?
Yeah.
Okay.
Investigation.
Ish.
In the investigations, I need to check.
Okay.
Yeah, brain imaging, see the frontal cortex.
Would you really regularly do this brain imaging?
لا بس
هتدفع من جيبك. No, I never did this for my patients, OCD patients. Why? No psychopathology. Yes, in the treatment, let me back in how will treat this patient.
biopsychosocial. In the
Okay.
bio, we start with SSRIs.
Okay, like what?
Citalopram.
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 في طبعا في citalopram. في citalopram وفي citalopram. The isomer of this, okay?
Yeah. We'll increase the dose.
How much?
Maybe 20. The dosage.
Of citalopram, 20 milligram accepted. This is psycho.
The psycho, I will do ERP and I have a couple of cognitive therapy.
Okay.
We'll try to do sessions
Okay.
to change in the behavior.
Okay.
And
Do you know what's called this?
cognitive behavioral therapy.
Okay.
Uh,
Fee specific treatment for OCD.
Yeah. Response and
Yes,
Yeah.
I accept it. Response, prevention.
prevention. Response
Thank
and
you very
prevention.
much. So he would issue a response prevention.
For maybe for his washing his hands a lot, I will put like flooding. I will tell him to put some dirt like me and check if there is nothing happening.
So you will prevent him from doing response.
Yeah.
Okay, this is response, preventing. Stop him or take, whatever tools he is using. Okay, thank you. And what else? Species 10?
Social.
And the social, I will inform the family to help him navigate through.
Or in response
Yeah.
prevention.